Hi, it's KCCK's Culture Crawl. I'm Dennis Green, and my guests today are from the Eastern Iowa Health Center with an upcoming event. Joe Locke is the chairman, president, and CEO of Eastern Iowa Health Center. Joe, welcome.
Good morning, Dennis. Thank you for having us.
Nice to see you. And development director, Stacie Eastman. Welcome.
Thank you. Good morning.
Nice to have you both here. Before we talk about the event coming up at Big Grove on the 18th, Joe, for those who aren't aware, tell us a little bit about the Eastern Iowa Health Center and what you do and what your mission is.
Thanks, Dennis. So Eastern Iowa Health Center is a federally qualified health center. What that means to the general public is that not only do we provide family medicine, just like when you go to the doctor, but also pediatrics, OBGYN, dental, and behavioral health services. And this year in 2025, we will go from seeing 41,000 patient visits last year to 71,000 patient visits this year. And that's before we open a new pharmacy and a new urgent care and start vision services this fall. We're actually starting a pharmacy, having our first soft opening day on June 2nd. So very excited about that.
So you're on the track to double even without all the new facilities.
That's correct. We expect to see more than 100,000 patient visits within the next couple of years.
What is the difference between a federally qualified clinic like yours and one of our other hospital or physician practices?
We're a really unique animal. There are 14 federally qualified health centers in Iowa that are all 501c3 nonprofits, and there are also 14 in Hawaii, so it's loosely population-based. But in all 50 states, there are more than 1,500 federally qualified health centers. The thing that sets us apart, however, is that if you can't afford your services, then we treat you anyway. We don't turn anyone away.
So does that duplicate with some of the other free clinics and services like that around town, or do you work together with them?
Great question. You know, when someone goes to a free clinic, it's because they typically have an acute need, they're hurting. And
kind of like an ER visit.
Yeah, it is. It's very transactional, which is great, and that people need that. We love the free clinics. What typically happens, though, if someone goes there and they say, oh, yes, here, and by the way, no money's ever changed hands at the two free clinics in town. What they do is they get treated and they say, here's a prescription for your sore throat, and they'll give away a prescription, that kind of thing, which is wonderful. But during the course of the exam, if they find out that they have another chronic illness, or 2 or 5 or 10, so diabetes, COPD, hypertension, obesity, I mean, just name 1 or 100, they say, you need a medical home, and let's call Eastern Iowa Health Center.
You need a family doctor.
Yeah.
Can't just handle this
That's right.
One shot.
That's right. And so we literally refer back and forth to them every day.
So you said federally qualified, so that means there's probably some public money that comes into this. But Stacie, I'm guessing that there is a pretty big gap to fill, and that's where you come in.
Yep, that's right. If there's always a gap to fill, we receive the same amount of federally qualified funds that we've received for the past, is it 10 years?
10 years, yeah.
10 years.
So it's never gone up.
It's never gone up.
Even though you've gone, you've increased 10 times the number of
Exactly.
patients you see.
Yeah, that's really true. I had 18 employees when I started 10 plus years ago, and now we have more than 130.
Wow.
Yeah. So obviously, we're growing, but the need for our community is growing even faster in a lot of ways. And so, yeah, you're exactly right. That's where things like our upcoming fundraiser is really important, because that money comes into our clinic and that stays local. And we don't only, see people from Cedar Rapids and Lynn County. We serve a 5-county area. So we have individuals coming from Lynn County, Johnson, Polk, Iowa, and Jones County. And so we see a lot of people who are in need of a lot of the services that we have. And like Joe said, our numbers show the need that's out there in the community. And we know that once we add in our urgent care in our pharmacy, which, like Joe mentioned earlier, is opening this summer, and we're super excited about that, especially since the Hy-Vee on First Avenue has closed and really left a pharmacy desert. We know that need's there. But I think one of the things that's really cool also about what we do is that, you don't have to be somebody who says, I can't afford your services. We see everyone at our clinic. Our clinic is open to everyone in the community. So if you have private insurance, if you have self-pay, if you have Medicaid, if you have Medicare, we see everyone at our clinic. So it really is a community clinic. And by saying that, I mean we truthfully are open and serve all people, not only in Cedar Rapids and Lynn County, but also in those other counties that I mentioned.
And one of the things that you do in order to raise funds to keep those services going is you, for the last couple of years at least, have done a fundraiser at Big Grove.
Correct.
In downtown Cedar. I was there last year, and it was a blast.
Yes.
So tell me about that coming up.
It's called Just for the Health of It. Last year was our first year in doing it, and this year's our second year, obviously. So it's Just for the Health of It, make it a double. And yeah, it's a great opportunity for people to just come together and have a really fun, casual afternoon. It's going to be held at Big Grove on May 18th, which is a Sunday, from 2 to 5. It is an adults-only event, and at the event, you get to have a couple drinks with your ticket purchase price. You also have heavy appetizers that are fantastic. We picked out some really great ones this year. We have great music from Funk Stop. They played for us last year. They're super fun, really well known in the community. They will definitely have you dancing. We have some really awesome games that we play that are games that anybody can do with prizes. So like last year we had a Steinhold, for an example, and people could win some fun prizes for that. And then we also have a silent auction, and this year we have over 30 items that include everything from trips to a signed jersey from Keegan Murray, who was a Iowa Hawkeye basketball player. So we've got a rookie jersey from him. We've just got a variety of things that people will be able to come and purchase and support the mission that we have at EIHC, which is outstanding care for all, exceptional care for all.
Big Grove is a great new venue,
It is.
and Funk Stop's one of our favorites. Matter of fact, they're going to be entertaining at Jazz Under the Stars this
Yay.
summer. So
that's so great. What a
they
great event.
kind of inherited the history of Eastern Iowa funk and horn bands.
Yes, they are fantastic. They truthfully are.
Some of the
Yeah.
original members of Mean Street and the Hellhorns, which goes
Oh,
back a
really?
few
Oh my
years, are a part
my gosh.
of Funk Stop. So
Yeah.
they're
Well, and they definitely add to the whole ambience. I think we've all been to plenty of fundraisers where you're like, oh, it's another dried chicken dinner, and they're not always super fun. This one really is just a casual event for your family and friends, where you can just come down, have some great music, have some great food, and just really support an awesome nonprofit.
And we've ordered great weather.
Absolutely.
Well, of course you have. Yeah. So putting the fun in fundraising.
That's right.
So it's coming up the 18th of May
Correct.
at Big Grove, 2 to
Yes.
5 p.m. Joe, as we look ahead to, you mentioned that we're opening a new pharmacy.
Yes.
And I know that your dental clinic and a couple other things have recently come in line, which is part of what has fueled all of this growth. What do you see out there in terms of headwinds or things that you're looking at for the future?
Well, we always try to find the intersection, Dennis, of what do we refer out for most, what do our patients need most, and where we can make a profit as a nonprofit, because a nonprofit is a tax status, not a way of life. So you got to make a little money in order to keep the doors open, right, and continue growth. And so this fall, Stacie wrote a great grant, and we received $250,000 from the Delta Dental Foundation, and we are going to start optometry in the fall. So that's our next thing after we do the initial opening of the pharmacy, which, just makes sense. If you have a pharmacy, why not have an urgent care in the pharmacy, go there, get seen by a provider, and walk out with a prescription. So that just makes sense.
The Eastern Iowa Health Center is open to all, and I guess that's also the other message, because we think it's easy for people in their minds to get you kind of lumped in with the free clinics and think, well, that's not where I go if I have my own private insurance. But
Right.
that is totally not the case. You see everybody.
Yeah, we actually have many providers who speak other languages. And so think about, the international flavor of the engineers at Rockwell and the folks that come from all over the country to Transamerica and other large corporations here in Cedar Rapids. It's always nice to be able to go see a doctor or a provider that speaks your first language. And so, that's just another benefit. We also have the privilege of really serving everyone. We have literally the Cadillac of interpretation systems. And so imagine an iPad with someone speaking your native language and having a three-way conversation between the provider and someone who's fluent in your native language and the patient. And it costs us $1 a minute, and we're on track to spend $500,000 this year just on interpretation.
Just on translation
that's right.
programs.
$1 a minute. It's a real privilege to get to see a lot of people where English isn't their first language. And so, that's a real privilege for us.
I mentioned off air that I've moved my primary care doctor situation to the Eastern Iowa Health Center, and I have really, really been impressed. I love the mission. I love helping to support a nonprofit with my own, but also getting great care.
And we really appreciate that. And that's one of the things about our pharmacy is, a pharmacy, when you have some kind of insurance, it doesn't matter what it is, if it's Medicare or Medicaid or private insurance, that's a contract between you and your insurance company. And so your copay is your copay. And so if you go to CVS, that money's going to Rhode Island. If you go to Walgreens, that money's going to Illinois. If you come to the new Eastern Iowa Health Center pharmacy, that money's going to stay right here in the community and go back to patients who maybe can't afford their prescriptions.
Well said, and something probably that most people don't think about. The Eastern Iowa Health Center is available, as Joe and Stacie have mentioned, to anybody needing just about any kind of care that you can imagine, and even more moving forward. And you can help support this organization at their fundraiser, Just for the Health of It, May 18th from 2 to 5 at Big Grove Brewery, downtown Cedar Rapids. Good luck with all the expansion and new projects that you have coming up, and thanks for being here.
Thank you.
Dennis. We
And
appreciate
if
it.
anyone is interested in purchasing their tickets as well, they can go to our website.
Oh, you can do that online ahead
We
of time?
do,
Oh,
yeah.
okay,
It's
good. Oh, good point.
www.justforthehealth.com.
Justforthehealth.com.
You
And
got it.
for those watching the video, that has appeared underneath
Awesome.
our smiling
Perfect.
faces,
That's great.
even as we have done this. Once again, good luck with it, and thanks for being here.
Thank you so much
Thank
for
you,
having
Dennis.
us. Thank
Have a
you.
great day.
You can hear the Culture Crawl live on the radio most weekdays at 10:30, on demand at kcck.org/culture, or subscribe using your favorite podcast player. Watch our videos on the KCCK Facebook and YouTube channels. Our producer is Lydia Kilgore. The Culture Crawl theme is composed by Vivian Shanley. I'm Dennis Green, and I'll talk to you later.